Welcome to another episode of Forward Thinking Friday on the Healthy Community, Wealthy Community channel. Today we're focusing on prevention over cure, specifically on the importance of cervical cancer screenings and getting a pap smear. Reproductive health is crucial for a thriving community. Cervical cancer screenings are essential for early detection and prevention. By getting regular screenings, we can catch any abnormalities early and take action before they develop into something more serious. How common is cervical cancer? An estimated 12,000 new cases of cervical cancer occur each year in the United States. And each year, about 4,000 U.S. women will die from this disease. The main cause of cervical cancer is human papillomavirus, or HPV, infection. There are many types of HPV. Some types of HPV, called high-risk types, can cause cancer of the anus, cervix, vulva, vagina, and penis. They can also cause cancer of the head and neck. Other HPV types have been linked to genital warts. HPV infection is very common. It is passed from person to person through sexual contact. Some research suggests that at least 3 in 4 people who have sex will get a genital HPV infection at some time during their lives. However, being infected with HPV does not necessarily mean that a person will get genital warts or develop cancer. HPV enters cells and causes them to change and grow abnormally. Usually your immune system gets rid of the virus quickly and the infection goes away by itself. But in a small number of cases, HPV does not go away. The longer HPV is present and the older you are, the greater the risk that the virus will damage cervical cells. Cervical cancer can occur at any age. It occurs most often after age 40, but it can occur at younger ages too. However, it rarely occurs before age 21. Your risk of cervical cancer depends on your sexual history, your immune system, your health, and your lifestyle. The most important risk factor for cervical cancer is infection with the types of HPV linked to cancer. The following factors increase your risk of becoming infected with HPV: multiple sexual partners. Having a male sexual partner who has had multiple sexual partners, early age at which you first had sex, younger than 18. Other risk factors include the following: a personal history of dysplasia of the cervix, vagina or vulva, a family history of cervical cancer, smoking, certain sexually transmitted infections such as chlamydia, problems with the immune system, and having a mother who took a drug called diethylstilbestrol, or DES, during pregnancy. Cervical cancer screening. What is it? Cervical cancer screening may include pap tests, testing for a virus called human papillomavirus, or both. In both tests, cells are taken from the cervix and sent to a lab for testing. A pap test looks for abnormal cells. An HPV test looks for infection with the types of HPV that are linked to cervical cancer. Follow these guidelines. If you are younger than 21, you do not need screening. If you are 21 to 29, have a pap test alone every 3 years. HPV testing alone can be considered for women who are 25 to 29, but pap tests are preferred. If you are 30 to 65, you can choose one of 3 options. Have a pap test and an HPV test, also known as co-testing, every 5 years. Have a pap test alone every 3 years, or have an HPV test alone every 5 years. If you are 65 or older, you do not need screening if you have no history of cervical changes and either 3 negative Pap test results in a row, 2 negative HPV tests in a row, or 2 negative co-test results in a row within the past 10 years. The most recent test should have been performed within the past 3 or 5 years, depending on the type of test. Remember, you still need to have screening if you have been vaccinated against HPV. You may still need to have screening if you have had a hysterectomy and your cervix was not removed. There are exceptions to these guidelines. If any of these apply to you, you have human immunodeficiency virus, you have a weakened immune system, you have a history of cervical cancer, or you were exposed to diethylstilbestrol before birth. You may need more frequent screening. If you have had a hysterectomy in which your cervix was removed and you have a history of cervical cancer or moderate to severe cervical changes, continue to have screening for 20 years after your surgery. If you have no history of cervical cancer or cervical changes, you do not need screening. See your OB/GYN or family practice provider regularly for a routine visit. Even if you are not due for cervical cancer screening, you should still see your OB/GYN regularly for birth control counseling, vaccinations, health screenings, pre-pregnancy care, and the latest information about your reproductive health. This information was designed as an educational aid to patients and sets forth current information and opinions related to women's health. It is not intended as a statement of the standard of care, nor does it comprise all proper treatments or methods of care. It is not a substitute for a treating clinician's independent professional judgment. This is Nurse Lanisha signing off. If this video was informative to you, please like, share, and subscribe to my channel. Also, click on the links below to check out my latest videos about disease prevention, obesity, chronic diseases, mental health, and sexual health. Remember, a healthy community is a wealthy community